All right. Good morning, everyone. Welcome to the July 11th, 2024 Connecticut Paid Leave Board of Directors meeting. I want to call the meeting to order. It's 9:02 a.m. and ask Amber if she would please call the roll.
Thank you, Alice. All right. Ava Bermuda Zimmerman.
Present.
Isha Canada.
Present.
Adrienne Cochran.
Present.
Andrea Comer.
Present.
Sheila Hummel.
Present. Good morning.
Ellen McKitterick.
Present.
Fran will not be joining us today. Alice Pritchard.
Present.
David Salazar Austin.
Present.
John Scott.
I'm here.
Mike Soltis.
Here.
Molly and Holly will not be joining us this morning. Janae Woods-Weber.
Present.
Good morning, Janae. And Justin will not be joining us, but we do have a quorum. Thank you.
Wonderful. Thank you so much, Amber. And I'd like to thank the members of the public for joining us today as well. So can I get a review of the June 13th meeting minutes? Are there any corrections or discussion? Can I get a motion to approve?
I'll make a motion to approve.
Thank you, John. Appreciate
I'll
that.
second.
Thank you, Adrienne. All in favor? Aye.
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 Any opposed? Any abstentions?
I'll
Mike,
abstain. I believe I
Okay,
wasn't there.
thanks.
sorry.
Okay.
Mike will abstain as well.
Okay, 2 abstentions. All right, wonderful. Motion passes. Ready to move on to our agenda. John, will you provide us with a quarterly claims administration update, please?
I will. Thank you, Alice.
Thank you.
And good morning, everyone. Let me just share my screen. And just tell me if you can see my screen.
We can see your screen, John.
Okay, thank you. Just gonna widen this out a little bit. I have a brief overview of claims administration for June 2024 and a fiscal year-over-year data comparison overview for you this morning. The 3-month claims filed trend is 24,353 claims received with a monthly moving average of 8,118. Second quarter claims volume increased over the first quarter of 2024 by 4.1%. Year over year, June claim volume was 5.23% higher, although there were only 19 business days in June of 2024. This slide illustrates 12-month moving statistics of claims by leave reason and percentage of claims filed by gender. The categories represented in the bar chart are the 4 largest leave reasons, totaling 99.45% of claims filed. The percentage of claims filed by category is in the left-hand column in blue. Other leave categories are in the chart on the right and total about 0.5% of total claims filed. The bonding data presented in that category includes 11,271 cases representing the bonding segment of pregnancy cases filed. Overall filing percentages for the rolling 12-month period are female claims filed at 63.32%, male claims at 34.25%, choose not to answer at 2.28%, and non-binary category is 0.15%. The race and ethnicity data table. This was collected on an opt-in basis beginning in August of 2023 when that got set up in the database and it was enabled for claimants to respond to those questions. The data reported are cumulative statistics from August 2023 through June of 2024. So we're only missing a single month in the fiscal year there prior to inception. The opt-in response rate for both race and ethnicity is approximately 31%, and approval and denial rates are relatively consistent with overall program rates. You can see a little bit of variation in a couple of the categories. However, in a couple of those categories, the variation is also with a very limited number of claims as well, and an opt-in basis, so it's a little difficult to judge. The year-over-year claims filed shows program growth with an increase of 7,296 claims. This represents a 7.61% growth rate in claims filed in fiscal year 2024 over fiscal year 2023. The data presented includes, again, that 11,271 bonding cases from fiscal 2024 associated with the corresponding pregnancy cases. This slide highlights the reporting impact of the successful customer service improvements made in streamlining pregnancy and bonding cases into one case. Cases filed are shown in blue, and the associated bonding segment of pregnancy cases filed are shown in orange. The reporting of these incremental bonding cases more accurately demonstrate program growth and represent a 12.27% increase in cases filed in fiscal year 2024 ended June 30th. Counting the bonding segment of pregnancy cases as a separate case provides a level playing field to compare year-over-year claim statistics, and when comparing Connecticut paid leave program to other state paid leave programs that count these cases separately. Fiscal year-over-year adjudicated claims show a 3.85% approval rate increase. When adding the bonding segment of pregnancy cases, approved claims rise to almost 64,000, and the approval rate rises an additional 2.97% to 78.44%. The denial rate also correspondingly drops to 21.56% when counting those bonding cases. The 6-month January 24 through June 24 period, totaling 30,210 approvals, has an approval rate of 74.96%. And when including the bonding segment of pregnancy cases in that 6-month window, approved claims increase to 35,632, and the approval rate increases to 77.93%. The weekly payments trend line graph shows significant weekly payment growth to an average of $7.99 million per week over the last 8 weeks. The trend is being driven by 3 components: a year-over-year increase in claims filed of 7.61%, an increase in the approval rate of 6.82%, and 2 increases in weekly benefit rates tied to minimum wage increases. These minimum wage increases compound to a 12% increase in weekly benefit rates as a result of those 2 minimum wage increases. The approved insight slide here showing unique employees paid, total days paid, etc. The number of unique employees paid by Connecticut Paid Leave has risen to almost 118,000. And the total amount the program has paid to Connecticut workers is now over $789 million. 2024 year-to-date total payments increased by over 25% compared to year-to-date 2023. So there's been a very significant increase in payments over 2023 in the last 6 months. Average weekly payment over the last 8 weeks have risen to $7.99 million per week. All payment metrics show significant growth from 2023 to 2024. And this slide illustrates customers' electronic filing, portal usage, and electronic communication. The web claim filing remains strong at 71% of claims filed. Opt-in for email and text messaging is very high at 85% and 79% respectively. And portal messaging is a highly utilized mode of communicating for claimants who prefer the ease of messaging their case manager. And CTPL's redesigned website claims section features a streamlined layout with easier access to improved claims filing and benefit information. CTPL website enhancements combined with AFLAC portal enhancements are helping to drive our efforts to inform and educate claimants and employers on claims process requirements. These IT improvements have helped facilitate increased approval rates and lower denial rates. The authority's internal customer service personnel, my team, the benefits team, and AFLAC personnel are now able to drive customers to these enhanced resources, and we are seeing improved claims outcomes as a result. We do have a couple of additional slides, which I'll let Aaron talk about. Does anybody have any questions on any of the data presented?
Andrea, go right ahead.
Okay, so I will move
Thank you.
along to the
Wait,
next
John,
slide.
hold on,
Hold up, John.
Andrea's got a
Oh, sure.
question.
Okay, sure.
Thank you. Just going back to the demographic slide, had a couple of
Yes.
questions.
Okay, sure.
One is, are the numbers sort of consistent with the state's overall workforce percentage? Meaning like, because I see that for Black and Hispanic Latino applicants, the numbers seem to be lower. And just wondering if that's consistent with what the workforce looks like writ large.
So that is a good question. The one caveat to all of this, I would say, is that the response rate is that, 31% or so. So it's a little difficult to know what the entirety of the population is. And in terms of what the composition of the state workforce is, I'd have to do a little research on that and certainly could take a look at that and get back to you on it. I am not entirely sure whether this correlates with the composition of the state workforce. But as I said, we could certainly take a look at that and make some comparisons and get back to you on it if you would like us to do that.
That would be great. Thank you.
Okay.
And I certainly appreciate your reminding me of the response rate. My second question is just around the approved versus denied in terms of demographics. Again, it seems like the rate of denial is higher for non-white applicants than it is for others. And, I don't know if this is an outreach question or if this is an Aaron question or if you have thoughts on this, but just curious about why there's an uptick in denials for those constituencies.
Yeah, so again, I would, just exercise some caution in reading into this data because we're only getting that 31% response rate. So it's a little difficult to judge what's happening in the overall program that way. And while a couple of those categories are a little bit lower than the overall averages, that is true. This is certainly the only data that we've gotten back. And hopefully as we build a repository of more information, we'll have a little bit more reliable information to kind of track some of that, some of those numbers. We could certainly take a look at that as well with respect to the state workforce, et cetera, and see how that correlates. But again, with a relatively lower response rate like that, it's a little difficult to ascertain whether or not that's a definitive trend or not.
Understood. Thanks so much.
Just to add to that, Andrea, this is actually one of the reasons why we wanted to make sure we were requesting this race and ethnicity data on a voluntary basis. But as you know, we didn't start by asking those questions. We only started last year because we were weighing sort of making sure that the application process was easy and didn't want to add extra burden, but we wanted to start looking into that very question. And so this is really the first sort of data that we can see. And now we know where we want to focus both our analysis and potentially our outreach.
Awesome. Thanks so much.
John Scott has his hand up.
Thank you. Looking at the increases that we're seeing in claims payout year over year, are you collecting any data or seeing any data from, say, the insurance commissioner's office where employers are changing their disability contracts or dumping their disability contracts, which might impact our payouts?
So that's a great question, John, and we'll be talking a little bit more about the claims impacts on our bottom line in the next agenda item. But I think that it's a great suggestion. We have not been talking about it with insurance about that question, and I'm not sure what data they gather, but we have a meeting with them set up next week already for private plan discussion, so we can add that to the information we ask for.
Sounds good. Thank you. I'll figure out how to lower my hand now.
That's great. No, thanks, John. Great question. Mike, go ahead.
Yes, good morning. So Andrea's question prompts me to ask a question. So when is this demographic information obtained? And I'm really interested in, do claims administrators have this demographic information when they make a decision, or do they make that decision blindly and then the information's connected to the demographics?
Well, the information is obtained at intake. However, it plays no role whatsoever in the decision process. It is not something that is factored in at all with respect to the decision process. There is an intake questionnaire form that they can pull up and review if they have any questions about some of the information on there. So it is accessible to them, but it is not part of the decision process in any way, shape, or form.
Yeah, well, I would anticipate that, but I don't know if this is even possible. I mean, it would add some integrity to that if the decision makers didn't have access to that. Now, it's difficult when you're dealing with maternity to not know that's associated with a gender, but so anyway, I don't know if that's possible to separate the demographics. And second, do we collect, I mean, the slides talk about demographics by gender, they talk about ethnicity and race. Do we collect demographics by age?
We do have access to demographics by age. I have not really presented them in the past, but we could certainly take a look at that as well. It does stack up just from kind of anecdotal tracking while we look at this information. It stacks up, as you might expect, kind of in that older bandwidth of demographics. There's more health related issues and things of that nature, but we could certainly expand on some of the demographic documentation that we're presenting as well, if you'd like to see the age bands also.
Yeah. Okay. I mean, I'm not looking for an in-depth analysis. I suspect, the maternity and bonding is going to be more youthful than the serious health condition. But I was just curious if we track that. Thank you.
You're welcome.
Thanks, Mike. Andrea, did you take your hand down or did you have a follow-up?
I did, but I was debating whether I wanted to ask it. But since you asked, my question in terms of the reviewing and processing of claims is about the extent to which AI is involved. And I asked that question in part because we've been having discussions here at the Treasurer's Office about unintended bias that's built into AI. So just wanted to ask that question as a follow-up to Mike's. Thanks.
Yeah, I am not aware of the use of AI in any of their processes at this point. They kind of have standard info with respect to intake and certainly telephonic intake with IVR questions and things of that nature. But I am not aware of any AI usage certainly in terms of processing the claim or any of those elements. In fact, the reality is that it's a little bit more of a challenge with respect to processing those claims and making those decisions, because we're looking at, while they're originally an electronic document, it is not something that's currently readable in any way electronically. It's all reviewed manually by each individual case manager. So those serious health condition docs and any of the other corresponding underlying required documentation are reviewed manually by each case manager.
I would go
thank
a
you.
little farther and say it's not being done. We have automatic processing at certain steps, such as when the application first comes in, the claimant has to identify the reason for the leave, that automatically prompts the documentation that the claimant has to provide. And so there's a computer path, right? So you submit your claim and a letter is generated automatically based on a template that says, oh, you picked pregnancy, we need a med cert, right? Oh, you picked caregiver, we need a family caregiver med cert and a family statement of relationship. So there's some automatic things that happen, but those aren't at decision points. Those are just at sort of ministerial, sort of housekeeping elements. And I think your question is really well taken, Andrea, because we always try to make the process more efficient, but we've always felt that you need that human intelligence to really look. One of the most important things that we've talked about with the claims managers is looking at the documentation as a whole, right? They're not always completed in the platonic ideal way. And so you really need to look at the entire documentation as a whole to say, all right, they check the box over here, but they provided this information we really need over here. We'll use that, which is hard to do with AI in its current form. So we're just not using it.
Right.
I do think, just to add to that, I think the demographic information is important from an outreach perspective. I think we need to make sure that we are making the process available and understandable. And because we still know that the number one reason for denials is lack of documentation. So we've done a lot of work on the outreach side to make sure people understand what they have to provide, to make sure it's easy, to make sure that we give people the time they need. And so I think that's really where we want to focus. And that's part of our community education coordinator initiative, as opposed to it being a person saying, oh, let me look at this documentation and it's all here, but I still want to deny.
I would also add on the kind of comprehensive overview of those required documents that the case managers are reviewing, that we do see on audit that we're looking at as a more holistic approach, as Aaron identified, and certainly providing that feedback to AFLAC when we see any issues that way where they could have looked at a document more holistically to come to a more appropriate decision or what have you.
All right, let me move some. Mike, your hand is still up. Do you have a new comment or just need to
I'm
take
all
it?
set. I do not have a
Thank you.
problem.
Okay. Okay, great. So John suggested that Aaron was going to take over and do a few additional slides. Why don't we move
Yes.
to that?
Yep.
Okay.
Thank you.
Oops.
So this
we go.
this is really for information purposes. I think Fran had made the request last month to show what we see by other states. And so, John, if you just want to click to the next slide, just so people can see.
Sure.
We have just over a dozen states plus DC that provide benefits with paid leave programs, either as one holistic program like ours, or some of the states like California, where they have a disability component and a family component. So, the maximum benefit for Connecticut is the second lowest. It will, that's just sort of the reality out there. It's something to know. Most states have 12 weeks, but some of the states have gone beyond that. Massachusetts, New Jersey, New York, Rhode Island, for example. So it's just kind of just for information purposes, wanted to share it in case anyone had any questions. Okay. And obviously we can share the slides. We share the slides with the minutes, so you can have this.
Okay.
Yeah, that's great. Thanks, Aaron.
All right. I will stop sharing. Thank you, everyone.
Thanks so much, John. Any other questions for John or Aaron before we move on to the next item?
Can I have
Yeah, go ahead.
one quick question for Aaron? Are there any other states that have no waiting period?
That's a great question. I believe so, but I haven't looked crowd chatting to me on the side saying, yes, there are, like Oregon. But we can definitely double check that and get the full list of states that don't have any waiting period.
Okay, thank
Yeah.
you.
Great. Ava, go ahead.
Just to continue on that question, when you look into the waiting period, if you could just be a little thorough in your report back of like, what's that impact look like? How long have they've had the waiting period, and if they didn't have the waiting period from the beginning of the policy change, what was the transition like? So I'm also curious as
Yeah,
to.
absolutely.
Okay.
We can pull that together. Also getting more help from the side saying Oregon and Colorado both have no waiting period.
Hmm.
And I know for those, because they're new programs, that's from the start. Whereas other states, if they have a waiting period, I think it's been from the start, but we can definitely pull together that information as a chart for you.
Great. Thank you. All right. Thanks again, John. We're going to move on. Aaron, could you lead us in a discussion of I'm going to read this, the effect of claim volume on future incident rate assumption. How's that?
Yes, absolutely.
Thank you.
So I try to get to this. So this is just another way of seeing the, shrink that, seeing some of the data that John shared. John's chart is very spiky. So one way of trying to smooth it out is just to look at the weekly average by month, just to smooth out some of the spikes a little bit. And this reflects the weekly benefit average by month since July of 2022, when we really had our feet under us and we were going smoothly. And so you can see that the trend is definitely going up. We did see definite growth this past spring, where in April and May, we were averaging about 7.5 million. In June, we were averaging over 8 million in terms of the weekly benefit average by month. Not the benefit that goes to a person, but the amount that we pay each week in total benefit claims. So we've been keeping an eye on that. And we've been working with the actuaries to do two things. One, they're working in their annual report, which involves a deep dive over of the full year's worth of data, looking at utilization rates, trying to make their estimates for next year. And of course, we have the ongoing contribution rate discussion. And so we wanted to share with you some of the changes that we are seeing, just so that we don't lose you when we come back next month to have a more in-depth discussion about the contribution rate policy, and then potentially in August or in September, a discussion about the contribution rate itself. With the contribution rate policy, we have developed some factors that are out for discussion amongst the public for things that we want to consider. And we've also developed a formula to consider to include not just what we anticipate the 10-year costs and contributions to be, but also what would we need for a contingency reserve. And if we anticipate having enough money to cover both the kind of expected net activity plus the contingency reserve, and there's extra money there, then we've been talking about, well, maybe it does make sense to consider reducing the contribution rate. And so this slide shows what we discussed last month, where even though we were seeing some growth, we still anticipated that there would be a surplus at the end of 10 years, even when you account for the contingency reserve. But as we said, we're continuing to see growth in our claims. Our outreach continues, our processes are improving, and we're seeing more claims and we're paying more money, and that affects the bottom line. So right now, just on preliminary assessments, if I can get the page to move, we're seeing some differences. We're seeing that we expect the net activity at the end of 10 years to be higher. We're seeing that we would need a contingency reserve that is greater. And we're also seeing that the anticipated surplus of the fund balance minus the estimated contingency reserve is lower and sort of not enough to really think that it would be prudent to start changing the contribution rate. Again, this is preliminary information. We're continuing to do a lot of analysis. We want to bring in more of the July claims data, not just the July money data. And we will be bringing more information to you all in August. But again, our goal is to have you not ever be surprised by our actions. So we just wanted to kind of put this out for your awareness. So just gonna stop sharing and see if anyone wants to discuss this.
Yeah, just one second, John. Aaron, just to confirm, as you all are having these conversations, is it going to the finance committee and they're getting to dig in with you on some of this? I just want to, as somebody who's on the policy committee, I want to make sure the finance committee is talking about that.
So this latest sort of, we did not talk about at the last finance committee meeting, but we will be talking about it at the finance committee meeting at the end of July. So it is definitely something that we will continue to include. It's just really this updated data together with the work that Spring is doing on the deep dive into utilization is something that really just came together over the last 2 weeks.
Great. I just want to make sure smart people were talking about it in committee as well.
Absolutely.
All right. So John Scott, go right ahead.
Okay, I gotta try to mute off. Refresh, I guess I'll just re-say the question. Are we doing anything about seeing if the insurance industry is dumping plans or changing the way their contracts are written? I think that's important information to collect from the insurance department. But refresh our memories. Are we excess of all the collectible disability policies? Or are we primary coverage? How does that read?
Right. So great question. Coordination of benefits is a really popular topic. Amber and I are working on a paid leave spotlight on that very issue. The statute is silent. The statute says employees can get benefits from their employer and from paid leave concurrently, provided the total does not exceed 100% of the regular wages, but does not set forth any sort of order or primacy. And so it's really left to the employer to tell us how they're going to handle it. So there are 4 options for employer-provided income replacement benefits during leave. Employee could be getting 0. We see that a lot. Employee could be getting 100% payment from their employer, in which case we don't pay any benefits during the period of time that the employee is getting 100% from the employer. So it could be 100% for the full duration of the leave, could be 100% for a small portion of the leave. You see that if employer requires the employee to use their sick time for a serious health condition, and so they are, maybe the first 2 weeks are being paid by PTO, and then they come to us. The other option is the employer pays a portion of the person's salary for some or all of their leave. And when that happens, we say, okay, if you are paying a portion of their salary during some or all of their leave, are you primary or are you secondary? And then we react accordingly. If the employer says they are primary, we say, how much are you paying? They say 60%. We say, okay, we'll pay 40% of the benefits that we would ordinarily pay. We can't guarantee to pay 40% of the person's salary because we don't pay our benefits based on salary. We pay it on that whole top 2 quarters of the base period stuff. If they are secondary, we pay what we pay, and then it's up to them to pay additional amounts. So we have no control. We just react.
So I guess thinking out loud, if we had our legislation changed to be excess of all of the collectible, would that be enough of a tweak that it could save us from these larger increases that we're seeing?
So it's a really great question. It is something that we've been talking about literally since the second board meeting. Like when we were in person at 450 in room C and D. Potentially, but there's a really significant concern that employers could simply drop, and then we'd be on the hook for everything, right? So, because we have learned over our experience that for group insurance, it is the vast majority of group disability insurance carriers have said sort of since time began that they are secondary, that they are the payer of last resort. So it would be something that I think we would see a lot of headwinds with if we wanted to make that change. And I think there is a significant concern that there's no obligation for employers to provide anything, and we wouldn't want to have people end up with less because our program exists. So it's tricky.
Yeah,
I think
it
we're
is-
just trying
so,
to,
yeah, I would think that a decent employer, particularly the larger ones, would probably not want to dump a disability benefit in deference to the state benefit just to, take advantage of our program. They'll probably have the thinking that they'll offer something better and broader. I guess I'm just, thinking, out loud, what are some of the tactics we can take with existing resources that are out there? I'd be curious to know if insurance companies have actually made filing changes with the insurance commissioner with respect to how their contracts read because of us.
yeah, so we can definitely ask that question, but I do know from previous conversations, really from 2019, that most of these carriers have had language sort of talking about being payers of last resort and being secondary to other governmental programs. Usually originally they were thinking about Social Security, but that language precedes a lot of these other programs.
Okay. I have
So
one
it's something
more,
we can look into.
I have one more question. Maybe I dreamt this, but did the governor sign into law this year a paid sick leave law?
So it's paid sick days.
Okay.
So yes. So the paid sick days law requires eventually, essentially all employers, there's a sliding scale in terms of size, to make sure that all of their workers get at least 40 hours. Maddie can correct me if I'm wrong. Of leave, you get an hour for every 30 hours worked. It's really, those paid sick days are really, we anticipate people would be using them for things that aren't serious health conditions, but are things that you can't go to work, right? Like if you are like me and can't get through the summer without a bout of poison ivy, there's going to be a couple days where you're not showing your face. But that's not a serious health condition. And so that's the sort of reason for paid sick days. We don't anticipate that will impact us too significantly.
Is that something that you're at least having our actuarial people look at as a possible?
Yeah,
Okay.
they're sort of aware of it. Again, we just anticipate it being a relatively minor impact because employers that already provide sick days don't have to add what they're doing. They already meet that minimum requirement. And so it really only affected employers who didn't provide any paid time off to their employees. And again, we do see that people will be using that for things that they couldn't come to us for.
Okay. I think that's all I have for now. Thank you.
Yeah, thanks, John. Great questions. Mike?
Yes, thank you, Alice. Following up on John's question, and thinking about that chart with all the other states that have paid leave analogous to ours, I wonder if we have any insight as to how they handle the primary, secondary issue that perhaps might give us some ideas to think about with the possibility of, putting ourselves in a better financial position without encouraging employers to drop the benefit.
Right. Great question. Again, something we've been looking at for a long time. Most of the other states have an employer component to the contributions, right? So I think there's only 4, including us, where it's fully employee funded. So the other states have the employer contribution, and that complicates that discussion about primary versus secondary because the employer is already paying in. I will say, at least for group disability insurance, the market it's very rare for group disability insurance to ever be primary. It's, you can't say 100%, but like you're talking high 99s for them that they are secondary. That's just the way the insurance industry works. For other types of employer provided benefits, other states handle it different ways. Like they give the employer credit for the money that they pay the employees. And so it comes sort of, it's built into the benefit calculation. It also affects the waiting period. So like in Massachusetts, you've got a 1 week waiting period. The employer may pay you during that 1 week. But regardless, even though, say you were out for 12 weeks, they count the 1 week waiting, or at least they used to. I could double check if they're still doing this, but if I'm out for 12 weeks, I don't get paid for that first week, but I don't get an extra week at the end. I get 11 weeks of benefits from the Massachusetts program. So and part of that is because the employer is paying in. So it's a much more complicated analysis because of the way the employer funded piece of the contributions gets factored.
Okay.
We can keep looking at it and we
Yeah.
can report back.
I mean, even if the employer's paying in, I would think some employers, the larger ones that John mentioned, might have some additional benefit, to supplement this. And then you get to the question of who goes first, right? The state or the employer. But I think, we should keep an eye on that to see if somebody else comes up with a good idea that balances those two factors, because I don't think we want to motivate employers to drop whatever additional benefit they're providing.
Absolutely.
Yeah.
Yep. We can continue to do research into that. And we maintain really good communication with the other state programs, so we can do that.
So Erin, any other comments on this? Any other questions, anybody on this, or are we ready to move to the next report?
Yeah, I'll just say more to come. We'll keep you all informed as we
Right.
keep doing the analysis.
That's great. Thank you so much. Maddie, I see you popping on. You want to provide us an update on outreach relating to the legislative changes? Thanks.
Yes. Okay. Good morning, everyone. You can see my screen.
Not yet.
Now you can see my screen.
Yes, we can.
Okay. Thank you, Amber. Okay, great. So good morning. I'm here to provide just a quick update on our implementation of Public Act 24.5, specifically the law's new definition of municipality in Connecticut paid leave and Connecticut FMLA. So as a reminder, a more significant change that was adopted in Public Act 24.5 is a clearer definition of municipality, as I mentioned, in Connecticut paid leave and Connecticut FMLA. So effective October 1st of this year, municipality is defined as any metropolitan district, town, consolidated town and city, consolidated town and borough, village, fire and sewer district, and here's the key, is each municipal organization that has the authority to levy and collect taxes. So this means that any entity that does not meet this definition will be a covered employer under Connecticut paid leave and Connecticut FMLA as of October 1st of this year. This includes housing authorities, local health districts, transit authorities, and certain libraries in the state. Any entity that does meet this definition will continue as a non-covered employer unless one or more of their unions collectively bargains to participate. This is current law and it's unchanged by the legislation that just passed. So as I mentioned, this new definition means that certain entities will no longer be considered a municipality under the law and they will be covered employers as of October 1st. So given that right now, our priority is to identify who those entities are, in addition to the few I just mentioned, including health districts, housing authorities, et cetera. And to make outreach to them to make sure that they understand their responsibilities as newly covered employers. So far, our outreach has consisted of emails to entities that we've identified will be newly covered employers. That list kind of continues to grow. And our partners at various state agencies have been really helpful in providing us with contact lists that we've used to send information about the new definition and really what it means, as well as an offer to meet to discuss further and answer any questions that anyone might have about this new change. We've also made outreach to various associations representing municipal interests with an ask to collaborate and or share our information to their listservs. In all of our outreach, we provide a fact sheet on the new definition and what it means for municipalities. We've also provided and have scheduled webinars with different groups. I didn't include this on this list, but at the end of June, we hosted a webinar just broadly on the new law and the changes, and then the definition of municipality was included in that. The link to that recording, in case anyone is interested, is on our YouTube channel. Yesterday, Erin also provided a presentation to local health directors. On August 14th, we have a webinar scheduled with the Connecticut Library Consortium, since some of their members will be considered newly covered employers given this change. And on August 15th, we're also coordinating a webinar in partnership with CCM. So I'm providing this information to everyone just so that you're aware of our outreach and the work that's being done given the change to the law, but also because we really welcome other ideas and suggestions that you may have given your own networks, or if you're willing to provide or to share our fact sheet to your own kind of network, we'd really appreciate it, just to make sure that everyone knows about the change in the law. So I will stop there. Thanks.
Questions, suggestions for Maddie? Maddie, I did wonder if you all were connected to the COGS. I know, that they have newsletters and maybe they could put the fact sheet out as well.
Erin, do you want to answer there?
Yes,
we were connected to them. Yeah.
Yeah. Maddie has written to everybody we could possibly think of, including the COGS. And actually, we've heard anecdotally feedback from some town folks who are like, oh yeah, we talked about this at the last COG meeting. So at least they're getting the word out.
That's great. Okay. Thanks, Maddie. Thanks, Erin. Mike Soltis, I'm going to come back to you and ask if you'd provide an update on the CEO performance eval.
Okay, good morning again. Just wanted to give you an update. In April, we adopted the CEO performance evaluation procedure, and that is a process that begins with goal setting in January, includes a mid-year evaluation in May or June, and then a larger process at the end of the year. Since the procedure was just adopted in April of 2024, we're primarily focused on the year-end evaluation. But that being said, Fran and I did have, we're members of the evaluation committee. We met with Erin last month for an informal check-in on Erin's 2024 goals. As part of the year-end evaluation, Erin will provide us with a self-evaluation in the fall, and we'll schedule an executive session in one of the fall board meetings to solicit board feedback. But in the meantime, between now and then, if any board member has feedback they would like to provide earlier, please feel free to email me or call me. And that's where we are in the CEO performance process.
Great.
Thank you.
Thanks. And Mike, why don't we have you go ahead and roll us into the committee reports as well and speak to the
Okay.
policy and personnel report? That would be great.
Our committee met last month, and we had a discussion regarding proposed changes to consolidated policies. And we're going to be continuing that conversation at the next committee meeting, hopefully to prepare something to present to the board.
Great. Michael, anything you want to ask? I know you're trying to have a low-key meeting here, but anything you want to add?
Nope, I think Mike nailed it. Most of the changes about consolidated policies are exactly what Maddie talked about with the changes in legislation, but there are a few other additional items in those changes.
Great. All right. We'll look forward to that at the next meeting. Jessica, love to hear from you about the Outreach and Engagement Committee.
Hi, good morning, everyone. So the Outreach and Engagement Committee met on June 20th. I provided updates on a couple of things, including some new creative for our user-generated content initiative. We also reviewed the activities that we were engaging in to celebrate Pride Month. We reviewed some of the new partnerships that have come about as a result of Nicole San Clementi's work as our community partnerships liaison. And we introduced Virginia Rezatok, who is our new grants and contract specialist, who's going to be overseeing the Community Education Coordinators Program. She came to our agency from DPH, and we gave an update on where we are with that process.
Great. Any questions for Jessica? All right, we're moving right along. Dave, provide us with a Finance and Audit Committee report, if you would.
Yes, of course. Good morning, everybody. Holly's not here today, so I'll be doing the report in her place. At the last Finance Committee meeting, there was an update on the 2 audits that are progressing, one from the Auditors of Public Accounts that started about a couple of months ago. They've made a request for several requests for information that we provided for them. This is the first time they are going to audit the benefits piece of what we do, and we have a meeting scheduled with them in about a week or so to start going over that a little more in depth. Also, the second audit is our financial statement audit with our new auditors, Whittlesey. That is also in progress. Our year end was June 30th, so that just happened about a couple of weeks ago, but we certainly weren't waiting for that. We've had many meetings with them and sent them preliminary information. And so we are up to date with all the information they've requested as well. So that was what was going on with the audits. We also did the usual financial statement update, which I will share with you now. I will say that I actually had the audacity to go on vacation, so I wasn't at the last Finance Committee meeting, but I do want to thank our Assistant Controller, Locke Foe, who graciously substituted in my place and presented the financials. I asked him if he wanted to do the same for the board meeting, but he said, no, thanks, Dave, you're back, you can handle that. So having said all that, I'm going to share the results of the May financials with you now, as well as a preview of June.
You can see your screen, Dave.
Thank you for the confirmation, Amber. Okay, so for the month of May, for our operating account, our expenses for the month were 1.5, almost $1.5 million. That's a little higher than usual, and that's because we had 3 pay periods for the month of May. So that bumped up the spending. But all the other spending was typical categories: outreach, contact center. We paid our quarterly expense of our grievance adjudication for appeals to our partners at DOL. So that was the norm there. Year to date, we are ahead of budget by over $3.7 million. And we expect that to pretty much play out for the rest of the fiscal year. In terms of bond money, there was no bond activity this month, so it was status quo. And so the bond money that's still available to the authority to use in the future remains at just under $2.4 million. For the contribution activity, the net activity for the month of May was a negative $35.9 million. That was about $2.8 million more than we had budgeted. The main driver of that being benefits paid. That's mostly because of we reimbursed Aflac for 5 weeks as opposed to 4 weeks. That happened several times during the year. So that's why the amount paid is a little higher than usual at $37.8 million. As Erin indicated, for the month of May, that average was about $7.5 million. It was actually about like 7.55, so almost $7.6 million on average for the month of May, which was a new record high for that. We'll talk more about record highs in a couple of seconds when we get to the month of June. Contributions were a little lower than expected for the month of May, but overall, year to date, we are still ahead of budget by over $54.7 million, and all the line items are ahead of budget there. And so for the year end, we expect to be ahead there as well. A contribution fund has reserves of over $599 million in it. So that's where we are at the month of May. Quick look at the month of June. Our operating expense spent was $1.2 million. That's pretty much where our spending per month is. No unusual activity or categories there. Also in June, paid out of contributions, we made our annual repayment of our bond money, principal and interest. That was at $2.1 million. That's per agreement with the Office of the Treasury, as well as the Office of Policy and Management. You may remember last year, we set the terms in stone for that. So those annual payments were over a 10-year period. This is the second payment of that. So like I mentioned, those are set in stone for the next few years coming. The benefits paid were almost $32.8 million for the month of June. As Erin said, that was over $8 million per week. It averaged out to about $8.3 million. And if you remember from the beginning of the meeting, John said the last 8 weeks were averaging $8 million. And so all these numbers tie in together to say that the dollar amount of the benefits has been going up. And as everybody has mentioned, everybody being Erin and John, we are monitoring that closely. We are looking at it with our actuaries and determining, is that just a blip? Is that just a summertime thing? Is this a trend? And so we'll certainly discuss that more with the Finance Committee at the end of this month. And again, with the board at future meetings as we get more data. So please stay tuned for that. Our expectations for the end of the fiscal year, which can you believe it, already passed. Like I said, a week or two ago, we expect spending to be about $3.7 million ahead of budget in terms of operations. And for contribution activity, we think we'll be north of about $62 million. And again, ahead in all categories for the end of fiscal year 2024. That's what's happening financially at the authority. I'm more than happy to answer any questions at this time.
Much, Dave. Everybody good? Any questions? Okay, thanks for the great info. We look forward to hearing all how it closes out. Erin, how about a CEO report?
Great, thank you. So just two things I wanted to mention. First, the Center for Law and Social Policy, CLASP, and Family Values at Work held a convening in Washington, D.C. A couple of weeks ago of all the paid leave states plus different advocacy groups. So John and I were able to go. Molly and Janae were invited by the organizers as a result of their roles in their primary lives. So it was great to see Molly and Janae there as well. Molly, Janae, and Jess were all panelists during the meeting. So we were able to have a great representation of Connecticut and all the wonderful things we're doing there. It was really useful. It really solidified our connections with the other states. And we learned a lot of information from the other states, the advocates, as well as from the Department of Labor Women's Bureau, which held sort of an add-on conference that the second afternoon. I also had the opportunity to meet with members of President Biden's administration with other paid leave states to talk about national paid leave policy and things that the federal government could do to help the states, including hopefully getting guidance from the IRS and the Department of Treasury about the taxability of our benefits. So it was a really great opportunity, and I think kind of goes to show how important we still are as leaders in this world as new states are coming on board. And secondly, I wanted to point out that today is National Cheer Up the Lonely Day. So in addition to reaching out to your friends and families and neighbors who might be feeling isolated, I encourage you to check out Nancy's most recent podcast. She interviewed Senator Chris Murphy and talked about loneliness, families, and mental health. So it's a good way to commemorate the day. And that's it for me.
Thanks, Erin. That's all great. Moving us right along, any old business that anyone needs to bring up? Not hearing any. How about any new business? Okay, I would then entertain a motion to adjourn.
So moved.
Thank you, John. Thank you, Ava. All in favor?
Aye.
Aye. Any opposed? Any abstentions? Okay, great. We're adjourned at 10:03. Thank you all so much for your time and attention, and we will see you all again soon.